I'm going to step back a little bit and talk a little more around the whole nausea and vomiting with chemotherapy. Some of the drugs that we use in ovarian cancer, cisplatin and carboplatin, have been found in basic science to drop one of the steroid hormones in our system, and often we'll use steroid medication like Decadron as an anti-nausea medication, and there's actually a logical reason now for using that particular medication because of these basic science studies that show a lowering of the steroids as a direct result of the platinum agents. So not only do we use the steroids to prevent the allergic reaction from the Taxol drugs, but there's now a biologic reason for also using steroids after the chemotherapy for anti-nausea purposes as well. Many of the cancer agencies have either independently or as groups, like in Cancer Care Ontario, formatted patient information sheets. And I know in Ontario, there are information sheets available through the Cancer Information Service or through your nurses at the cancer agencies on different symptoms related to taking chemotherapy drugs. And there is a very nice patient information sheet on constipation, which you can either call for or I'm sure could be made available to you through your nursing staff at the Cancer Center. So in conclusion, having a feeling of fullness or not being hungry is a symptom of ovarian cancer and can be a consequence of the diagnosis of ovarian cancer or the treatment of the disease. Nausea and vomiting is more commonly a complication of the chemotherapy. Constipation seems to be a consequence of some of the anti-nausea medications we use for treating women who are on chemotherapy. Diarrhea is a new symptom that we're seeing in women who are exposed to some of the biologic agents. And you need to be aware that there are patient information sheets available for how to handle these different symptoms like constipation, and you can get those either by calling for them or by asking your nursing staff at your local cancer center. Thank you very much.
Hi, thank you, Dr. Allen. It's Jan speaking now. I'm quite excited and honored to have the opportunity to speak for Ovarian Cancer Canada, and I believe that informed patients are partnering with their oncology teams to help prevent and reduce these side effects. So I'm going to share with you some of the things that I've learned. First of all, I'm going to jump right down to some strategies that I think are important, and I'm going to focus on the non-pharmacological or non-medication treatments. When looking at nausea and vomiting, we also recognize that the treatment plans are complex and individualized. However, intuition and common sense is sometimes the right strategy in order to minimize the risks and the severities of the symptoms. If vomiting is severe, restrict your diet down to clear fluids and notify the team that you're working with. Walking is another form of exercise which is key to optimizing your ability to cope with side effects. Fatigue is actually one of the most common symptoms reported by cancer patients, and I find walking can improve mood, sleep, and constipation in many of my patients. It can improve socialization, especially if you're engaging friends and family to walk with you. Other forms of exercise are yoga and Tai Chi. Consider these diversional activities such as relaxation, distraction techniques, including guided imagery, which focuses on the positive emotional state of mind, and music therapy has also been found to be very helpful. For some women, hypnosis has also been an option to consider. Meditation and prayer has been effective coping strategies for many women. Acupuncture and acupressure may decrease symptoms, experience, or at least minimize or decrease the experience and intensity of the nausea. Foot massage is something that's been helpful in past for some. Deep breathing exercises is a relatively simple exercise to perform. Recall strategies that were successful during pregnancy, illness, or other times of stress, even, for example, sipping on some flat cola drinks. When all else fails, the use of humor may be helpful in changing your attitude, finding something to laugh about every day. Modify your environment. People find a cool, well-ventilated room, maybe opening a window or trying a fan may help. Consider dimming lights and decreasing noise levels in the home, as well as trying to eliminate the noxious sights or smells. Some people prefer to try aromatherapy, such as burning candles, whereas others may find they need to limit the use of perfume and perfume lotions to aid in comfort. Wearing comfortable clothes and loose clothing may be beneficial. Herbal supplements, there's some evidence to suggest that ginger, dried or fresh, has been known to have an effect on decreasing nausea associated with chemotherapy. However, there's been some suggestions that herbal supplements may inhibit the effects of some chemotherapy treatments. So I recommend that you discuss complementary and alternative medicines with your healthcare team. Increased frequency of oral hygiene may be helpful, but also some women find it's very difficult brushing your teeth when you're nauseous, as the gag reflex can be triggered. Use rinses to combat sore mouth, such as a half teaspoon of salt and water, or even adding a half teaspoon of baking soda to that may increase your comfort. Considering some food and diet changes, when I discuss the following options, also you may discover that one option is recommended for one side effect, but may not be recommended for another symptom. So you need to use discretion and common sense with some of these suggestions. Consider eating and drinking slowly, eating small but frequent meals. Consider using a smaller plate to avoid feeling overwhelmed with the volume of food. Consider chilled foods and liquids served separately to avoid filling up on the liquids only. Salty foods such as dry crackers and dry toast may also be more tolerated. Replace fluids with popsicles, for instance, or sports drinks like Gatorade, and try frozen fruit or yogurt bars. Avoid movement or reclining within the first 30 minutes of eating. Modify the oral intake to maybe some bland, soft liquid or high-calorie, high-protein diets. For example, a 3 or 4 ounce serving of protein is about the size of a deck of cards, and I do believe it's important to include protein in your diet as much as possible. Avoid greasy, fatty, and fried foods. Consider keeping snacks readily available, for instance, in your purse or in your car. And try to make some of these foods look a little more attractive on your plates, and try garnishes and thinking about putting in nice place settings and accessories. Consider trying commercial prepared foods and supplements such as frozen dinners. There's nutritional drinks, Ensure and Boost. Try adding fresh berries to these drinks to enhance the taste, or packaged liquid drinks. Various recipes to make energy drinks or smoothies exist, combining low-fat yogurt, bananas, vanilla extract, honey, and coconut is one example of a blenderized drink, and another is apple juice and a banana and a cup of berries with pineapple juice. Recognizing pineapple and grapefruit juices, particularly grapefruit juice, is one of those juices that do change a lot of different medications, especially heart medications. Sometimes it's a matter of being creative and willing to experiment. One day you may feel like a food item, and the next you may not, the next day. Consider making a grocery list and think about the following items to have in order to make it a simple and quick meal: yogurt, whole wheat pastas, frozen vegetables, frozen berries, canned salmon, canned beans. Think peanut butter, stocking up on frozen entrees or prepackaged meals like stir fries and crock pot meals may be helpful. A variety of healthy options are now available in a lot of stores, and the fresh counters for the entrees where you just simply have to reheat them at home. When friends are asking what they can do to help, suggest a simple casserole for 1 or 2, even considering sharing some of your favorite recipes with others to prepare for you. If cooking makes you nauseated, have someone else cook the meals. Consider microwaving foods and using frozen or chilled foods, because these tend to give off less odors.